If you have hearing aid insurance coverage, you need to make sure that you watch this episode of the Dr. Cliff Show. Hey guys, welcome back to the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And I am joined once again today by my co-hosts, Dr. Rachael Cook and Dr. Kelsey Beck. Welcome back to the show.
Thanks.
All right, so today we're going to be talking about this, I guess, beef that's been going back and forth between Oticon and United Healthcare and probably other insurance companies as well. But to provide a little bit of context here, Oticon, when they released their new Oticon Intent hearing aids, they basically came out and said, we're not going to include these as a part of any of these managed care formularies that are out there. And I know a lot of viewers out here are probably wondering, what the heck is a managed care formulary? So let me just kind of break it down first before we start getting into a lot of the beef that's been going back and forth. So if you guys have insurance, I want you to think of your insurance like this. You pay your premiums every month, and you have a certain agreed coverage for those premiums that you pay. So if you want to go into a doctor, your insurance company will pay for a portion of that doctor's visit or all of that doctor's visit if you've met your deductible, right? And you pretty much can go to whatever doctor that you want to. And if they're in network, that's great, you get better coverage. If they're out of network, that's still okay. Usually your coverage isn't as good with an out-of-network provider, but at least you can use your out-of-network benefits from your insurance company. So how does this really work from a hearing aid standpoint? Well, insurance companies have been having hearing aids as a part of their offering for a while, and not every insurance company, and most people are thinking, well, what about Medicare? And no, Medicare does not have any hearing aid benefits inside of their insurance program. But when we start looking at, Medicare Advantage plans or some private insurance companies, what they've essentially started doing is they're like, you know what, we could offer hearing aid benefits as well. But we don't really want to have to administer all of that. Mm-hmm. So why don't we just contract with what we call a third-party administrator and just say, hey, listen, guys, you take over the hearing aid coverage with that. You give our members whatever kind of discount on hearing aids that you want. We'll pay you some money, and then you can dole out that money to whatever provider is willing to fit hearing aids under your program. Yep. And so what has really happened over the course of the past several years, decade or plus, is that a lot of these third-party companies, they're basically like middlemen, and they take a good chunk of the money for themselves. They pay out these small fitting fees to the hearing care professional, and so instead of people using insurance benefits with their hearing care professional, they're using a managed care discount with their professional, and so the professional gets paid very little money. What happens when people get paid really little money? They tend to cut corners because they have to serve so many more people just to stay profitable. Yep. Mm-hmm. So that's kind of the situation that we're in right now. Well, like I was alluding to a little bit earlier, Oticon, I think they've kind of started to see that, you know what, we're ending up like discounting our products to these third-party administrators that is being administered, through these insurance companies, and it's probably not the best business decision in the world because they're likely losing money on every single one that they do compared to just going direct with a private clinic. Yeah. So the Oticon Intent, which came out, I think they announced it like February 26th of 2024, literally the same day, there was an email sent to hearing care professionals basically saying that they are not going to participate in these managed care formularies with their newest technology. And I think that before we kind of get into discussing this further, I should actually read the email so everyone has a context, and we'll put it up on the screen here for you guys. All right, now this is from Gary Rosenblum, who is the president of Oticon. Dear valued partner, I am writing today to update you about Oticon's future managed care product portfolio strategy. Our partnership is founded on Oticon's commitment to consistently provide industry-leading technology to delight your patients and world-class business support to help you grow your practice. For 2024 and beyond, Oticon will no longer offer its newest innovations for inclusion on managed care formularies. We will reserve our newest innovations for non-managed care patients to be fitted by only licensed hearing care professionals. Number 2, Oticon has a robust portfolio of products which will remain on managed care formularies, so patients will still have access to existing portfolio, including the technology tiers and variations of Oticon Real, Oticon Own, Oticon Exceed, Oticon Cross, Oticon More, Oticon Zircon, Oticon Ruby, and Oticon Open S. Boy, they really start going way back on those. Number 3, Oticon will not be offering its newest innovation, Oticon Intent, to managed care companies for addition to formularies when it launches on February 26th. At Oticon, we believe in providing not just products, but a unique experience that goes beyond the ordinary. Oticon's brain-hearing philosophy supports the most personalized fittings possible. Our newest innovation should be in the trusted hands of hearing care professionals so that the patients can benefit from the full breadth of your care and expertise. We fully understand that patients who leverage managed care benefits should have access to great technology, and hearing care professionals who accept managed care in their practice should have a broad portfolio of products from which to choose when treating patients. Hence, we are maintaining access to our current portfolio to give those patients access to Oticon's superior technological solutions. I'm hopeful that our decisions and the rationale behind the decisions make sense to you. Please do not hesitate to reach out to me with any questions or comments. Best regards, Gary Rosenblum. So there's a lot of stuff to kind of unpack there. I think let's talk about the first part, though, is that basically they're coming out and saying, yep, our newest stuff is not going to be included in managed care.
Can't have it. Love it.
I personally might have a slightly different view. I totally understand no pun intended. The intent.
Oh,
no pun intended.
Stop the show.
But what I will also say is that I think that a lot of people who do leverage their managed care benefit, a lot of the time are also people who could not afford to go to a practice who does all private pay, who doesn't go through, their insurance company as well. And so I think that there's a conversation to be had around, is that fair? Is that, kind of classist to some degree? And again, knowing full well that I completely understand where they're coming from, and I think that from a provider standpoint, I'm super on board with this decision as well, because I think that it I'm hoping that it will make these third-party managed care companies think twice about what it is that they actually then will, pay providers to do this work. It might incentivize them a little bit to up their game to some degree as well. Maybe we can, earn all of these top, products back to some degree.
Yeah. There's a lot of ways to look at this, and I do also kind of sympathize with the aspect that sometimes when people need to afford hearing treatment, if they don't have any kind of benefits or coverage to do so, it makes it inaccessible to them. Here in the United States, because pretty much this only really impacts us in the United States right now, because other countries either have universal health care that will cover hearing aids, or they don't have these type of insurance companies that are out there that are seeking to just maximize profit at the expense of their members, right? And maybe they do in some countries that I'm unfamiliar with, but here in the United States, I mean, not only do you have an option of like going to Costco to get hearing treatment for even less than what it would cost you on your managed care in most cases, a lot of hearing care professionals have competitive pricing that you essentially can get the same thing with them at a similar cost to what you would have to pay to get it through a managed care or a third party, and they essentially can profit some more, which means that they can spend more time with you and do a better job. So, I do understand the sentiment of that, but there's always, that's the great thing about, at least in the United States, being in a free market system with private clinics anyway, maybe not hospital systems or whatnot, but like we could literally pivot and choose to do a competitive offering if we wanted to, if we felt that it wouldn't, lower the quality of our care, right?
Yeah.
And, Oticon, I mean, for them to continue to create new and innovative products like they have, which I would argue that the Intent is the best hearing aid that they've ever released. And I don't even think it's close compared to their previous generation devices, but they don't get to make new innovative products if they don't make money.
Yeah.
Right? I mean, we can talk about, affordability and accessibility all we want to, and even all these like lower tier devices that are available out there on the market, the technology that's inside of those was once pioneered by one of the major hearing aid manufacturers, and it was just basically that idea was taken and put into a different device that's a cheaper device. So,
and I get that, and like I said, I think that too. All of the from their initial email about leaving all of their previous generations out there and accessible to other people. I mean, those other hearing aids are not bad hearing aids by any stretch of the imagination. I do think, just like you said, I mean, I've only fit, a handful, I think, of the Intents at this point, and I'm actually really impressed. And I don't think I very frequently will go, one generation to the next and, genuinely find, this technology is different, this is new, and I did find that with the Intent thus far as well. I mean, those are still really good products that are available.
Yeah, I'm thinking it would be one thing if Oticon said, you know what, we're going to pull our entire product line. Mm-hmm. I think that would be one thing that I'd go like, wow, holy moly. It'd be another thing if they said, we're going to take the most 3 recent platforms away from you. Mm-hmm. We're going to take the Intent, the Real, and the More, and the Openness, or whatever. But I think the fact that they're just doing the newest and the latest and the greatest is to really prove a point of, you know what, on the provider side, those who have participated in managed care, it's very rare that you find a provider that participates with managed care that feels like, you know what, I am so well valued for my time. Yeah. I'm well paid, I'm well valued for what I do. It's hard to find someone who's going to say that. On the flip side, from the hearing aid manufacturers, they're having to cut major deals with third-party providers to allow their product to be dispensed at the price level that it is dispensed at. And so, again, this idea of having this third party in the mix, you now have 2 sides in the middle, or on either side. You have your providers who are feeling a little stiffed in the process. You have your manufacturers that are feeling a little stiffed in the process. And I think both sides are eventually going to wake up and go, wait a minute, why are you here?
Yeah.
Why
are you here? Where did you come from?
It's funny because the people who win, are the insurance companies first.
Yeah.
So the insurance company's like, this is great. We're just going to have you take over our hearing aid benefits. We're going to save money because essentially you're going to make the patient pay more money, and you're going to give less money to the provider and less money to the manufacturer, right?
Win-win.
And then the managed care company's like, this is great. We basically do almost nothing, and all we have to do is basically market to the members of the insurance company and say, hey, you have a hearing aid benefit, go in and use it.
Yep. We need to come up with a trifold pamphlet and some really solid emails and guess what? They do, though. Because patients will come in. My Medicare Advantage plan covers hearing aids for me now. And I'm like, oh, hang on.
But does
hang
it?
on, does it
right?
really?
Does it, exactly.
And in what way? What do you risk by going with a managed care plan?
Hey, but my third-party coverage from my Medicare Advantage plan basically says that I get a discount on this, and you still end up spending thousands of dollars in most cases with those plans. And oftentimes you could end up spending an equivalent amount of money by going to a private clinic that if you tell them, like, hey, here's my budget, they will literally find you an option within your budget, right?
Yeah, and I think too that there are a lot of financing options, and there are a lot of ways to be able to afford these kinds of things as well. But the other piece of all of that is, we do some lectures out in our community about, different hearing aid technology and all of that. One of the things that we talk about, though, is performance and background noise of different kinds of hearing aids. And one of which is, a hearing aid that at this point, when the article was written from now, is probably like a 15-year-old hearing aid at this point, and how it functions in background noise compared to all of the newest technologies. And one of the comparisons they make is, well, this older hearing aid was fit the right way, using real ear verification, right, meeting your prescription, performs really well in background noise, and then it compares it to all of the modern hearing aids, right, that perform terribly in background noise, worse off than the older hearing aid because they weren't fit the right way.
That's right.
And so I think that it lends to this idea as well, again, kind of what do you risk by going that managed care option? Because if hearing care professionals are now forced to cut corners because they have to keep their doors open by cranking through patients every single day, they're going to cut those corners that are going to make even an older hearing aid, or even the brand newest of the new, if they did even have access to the Intent, right? Yeah. It's going to make that hearing aid perform less well because you had to skip corners in order to get that person that hearing aid anyway.
When we first started the clinic, I participated in a lot of these third parties, okay? And I was like, my schedule was free and open. So I'm like, well, shoot, I've got 2 patients on my schedule today. One of them is a third-party managed care patient. I'm going to give them the same quality of care that I gave my private pay patient. But I could, because I had plenty of time to do so. The way that these companies market to the providers anyway, it's like, hey, you should join our network of providers for this third party.
Yeah.
And they say, we can help you fill gaps on your schedule. And I'm like,
got so many patients waiting for you.
Yeah.
Don't you need a little bit more? You could use a few more patients, right? You could use a little.
Right? And then what happens is you end up getting busier, and then you're like, well, shoot, I literally can't see all of these people and give them the same quality of care. So you end up cutting corners. And so you decide, like, is this even worth it? Like, if I have 90% of my schedule filled by managed care patients, I literally can't keep my clinic open. If I have 1 or 2 on there, maybe I can, and it's not a problem. I can remain profitable, I can hire new audiologists and all that. But ultimately, clinics get suffocated by these, and I don't want to get too far ahead of myself here, but from Oticon's standpoint, they know that they're not going to be as profitable as a company, and they're not going to be able to continue to create new technology and new innovations and things like that if they don't have the private practitioner paying them what their hearing aids are actually worth versus selling their hearing aids at a massive discount to these insurance third-party companies. Right?
Well, it sends a really big message too when you look at the company or the hearing aid manufacturer overall, and the fact that pricing is different. So you have these relationships with hearing aid manufacturers, and not every single practice or every single hospital system or whatever is going to purchase that hearing aid for the same amount from the manufacturer. So when you have these hearing aid companies that you work really closely with as a private practitioner, who you get a certain amount of pricing, and then you see the managed care cost of those hearing aids and what that price got down to, and you start doing a little bit of math of, okay, what's the third party getting paid, what's the provider getting paid, and then you look at it at the end for the actual devices and you're like, oh my gosh, you can end up with the full thing less than I can even purchase a set of hearing aids. As well, what message does that send to a lot of the hearing healthcare professionals that aren't involved with managed care, that do want to fit your product, but it's like, oh, well, for you, it's going to be 3 times more expensive because our managed care partners, and I'm like, which one are we valuing here? You know, so it does make a huge statement of saying, like, you know what, we value you and we value managed care. Here's how we're going to show the differentiation between the two, though.
So when this email came out, a lot of audiologists were happy about it. They're like, great, now we're not competing with something that we really can't compete with unless our patients understand the value of quality of care.
Exactly.
Right? And sometimes, people just see dollar signs. They do not see, like, what do you actually get for that dollar, right? When it comes to quality. But literally hours later, we all got an email from Bernafon.
Yeah, sounds kind of interesting.
Right? So now, if you're unaware of Bernafon, Bernafon is essentially a second-tier brand, we'll call it, by Demant. Now, Demant owns Oticon, Demant owns Bernafon. So really what Oticon, I believe what they're trying to do here is they're trying to differentiate themselves as being the premium brand inside of this particular company. They're the ones who come out with all the newest stuff, the newest innovations. That stuff trickles down eventually to their other brands. But then you have Bernafon basically sending out an email, and I'll read that email for you guys. All right, literally the same day this came out. And this is from Roger McGuire, the Vice President of Managed Care at Demant. Dear valued partner, hearing care professionals who work with patients with hearing care benefits want choices to best support the needs of these patients. The care you give and the recommendations you make are important because your patients deserve the highest standard of care that you have to offer. Demant is pleased to announce that you will soon have more choices for your patients who use hearing care benefits through a hearing benefit manager, a third party, essentially. Effective April 2nd, 2024, an upgraded portfolio of Bernafon products will be available exclusively for select hearing benefit managers and the plans that they cover. Hearing care professionals will be able to access a broad portfolio of both Bernafon and Oticon products when choosing the right hearing care for these patients. The new Bernafon product line features the state-of-the-art technologies that Demant is known for. An upgraded platform, upgraded feature sets, and all-new, easy-to-use software make this product line perfect as a managed care solution. Bernafon's newest innovation, Bernafon Encanta, I think that's how you say it, has been designed with the hearing care professional in mind, not the patient. Anyway, sorry. The Bernafon Incanta solution is straightforward, easy to learn, and easy to execute in the clinic, optimizing the fitting as well as the clinician's time. Bernafon is committed to providing in-person, field-based, and remote-based services to ensure you have the right level of support, providing best-in-class customer experience for you and your patients. Bernafon customers will be assisted by U.S.-based inside sales and field sales staff. Sign up to be among blah, blah, blah. We strongly believe that the continued evolution of managed care requires flexibility, and the addition of this innovative product line helps us all to provide the best options for patients that we serve. Best regards, Roger McGuire. That's interesting.
Very.
It's interesting because you can tell that they're like, you know what? We want to make sure that providers understand that, like, this is super simple product line to understand.
Yeah. Oh, yeah.
Not going to take you a lot of time. You can burn through your patients, just like hit these few buttons. Like, that's what I interpret.
You want to know why they're doing that?
Why?
Because they say, oh, all of the quality that Bernafon's known for. I don't know Bernafon for nothing.
Nope.
I've never touched a Bernafon product at all. So it's like, it's known for. I'm sorry, you ain't known for it, at least
maybe in other countries.
Other countries, for sure. I'm not saying that if you have a Bernafon device that, like, oh God, it probably is a fine product, but it was like saying, you'll get the hang of it quickly. Don't get too concerned. I know it's a different name, but
It honestly, to me, didn't necessarily sound like that either, which is what I think is so interesting about, just human beings in general, is that we can all hear something
interpret it totally
a little bit differently. Because the way I heard it was, we're really, yes, like, no one has really heard of our product, right? Like, we're not that big of a name, but we're going to now differentiate ourselves, and we're going to update the, other line of devices that we have.
Yeah.
We're also going to make it so that it's reasonable for the clinician to be able to click through things quickly, because that is the structure of managed care. We're trying to create this in a way that's going to work for you, going to work for patients, where patients are still going to get the benefit. You're going to get something that's easy to use, and that you can keep up with this managed care, carousel, essentially, like, where you just kind of keep going, turning and burning, right? And so I kind of heard it a little bit differently. But all that to say is, I think that it's a good idea that with all of this, they're like, and you know what, because we aren't doing this, we're taking steps to make sure that the things that we are doing are up to date. You are getting good technology. I think that it's actually a really good idea to mash all of these changes all at once, because again, I think it shows that yes, we're trying to prioritize the field. We're demanding more for patients who use our products, and we're still giving those really good options to the people who may not be able to go that direction, trying to increase their accessibility.
I completely agree with that, because it's not like if you use a managed care plan that I want you to have bad devices or subpar devices.
Well, they still want to make money on the managed care side.
Of course, but I still, from a patient perspective, if you do decide to go through with a managed care benefit, I don't want you to end up with a bad product. I want you to end up with a good quality product, but I think it's going to be really, really important that we do start differentiating between the products that you can get through independent or private practices versus the products that you get through managed care parties. And this is going to be a really good way to say, you know what, we have these awesome products, but they're under a different name, and if you want to get the newest and the latest and the greatest from Oticon, you're gonna have to go see an independent private practice audiologist or ENT facilities, hospital facilities, but someone who's not through that managed care umbrella. I think that it's a great way to deliver the best of both worlds of, here's some really high quality products if you're going to go through managed care, but if you want the newest, if you want those intense because they're amazing, gotta go see one of us.
It does bring a lot of value to the professionals in all of this, because we say it all the time, you could have the best hearing aid in the entire world, and if it's not set up the right way, you're not going to do as well as you should, right? And how will you as the patient know if you're doing as well as you should? Because what do you have to compare it to? People didn't go to school for, a decade to be able to be doing all of this stuff for themselves. And I think that it's a good step to kind of reminding people that there is value to be had when you go and see someone who's going to sit down with you, who's going to do it the right way. And I think that's kind of cool to get some backup from a hearing aid manufacturer.
I wonder if they take any heat for their products not working well for patients if they're set up very quickly. Like,
oh, I'm sure they do.
Do you think that Oticon said, we can't keep offering the newest and latest and greatest because it's getting a bad rap because of the fact that people are getting fit in 15 or 20 minutes and sent out the door, and they're like, I hate this product, and it's like, well, how long did they spend setting it up with you? Oh, 15 minutes and I've never been back again. And they're like, well, it's not the product's problem. It's, it's how they've been set up, programmed. It makes them look bad. So I'm almost wondering now if this is a way to be like, you know what? If you're going to have this managed care experience, it's going to be under another name because we can't have you associating it with, you know, Oticon when it's being set up and administered in 10 minutes, you know?
So there's definitely, both of these obviously were emails sent to the providers.
Yeah, they're very provider worded.
They're very provider worded, right? And of course they're probably going to expect some talking points that we pull out of this when we share it with patients, right? But the different tones of each of these emails. The first one was really innovative products, you know, require a hearing care professional to optimize, like all about like, you know, you really need to make sure that you're going to someone who knows what they're doing, and we're reserving these newest products for those providers. This is much more of the tone of like, provider doesn't really matter a whole lot as long as it's simple, because
simple, easy,
get the patient can come in,
flexible.
still get a good device, but you can fit it super quick, get them out the door, because we understand that time is money. Kind of like that's kind of what I.
And when you're in managed care, ain't that the truth?
That's so the truth. That's like the only thing that you care about.
I mean, I used to work almost exclusively with managed care. The carousel that existed in that office of just get them in, get them out, and do whatever you can to make sure that they don't end up on the schedule again.
Maybe it's more the tilt-a-whirl rather than a carousel.
Whatever, it was the roller coaster that dropped off a cliff. It was just like, figure out how to make sure that they leave and don't come back. And I was like, this goes against everything that I stand for as a provider. I hate this. At first I saw it as an opportunity of like, oh, I'm so happy we work with these plans. We'll be able to let anyone who has an insurance benefit for hearing aids use that benefit. Can't wait. And then I realized that, this literally means I have 15 minutes with people.
Benefits not seeming like such a benefit anymore.
No, and then it's like, okay, great. Now you have a fantastic pricing on these top-of-the-line hearing aids, and I have 8 minutes to optimize them for you. And so you call back because you're having problems because we never got to go through a proper fitting process to begin with. And now you think that these really nice, high-quality hearing aids are garbage, and it's because they've been set up for you terribly because I've had no time to see you.
Maybe you could just refer those individuals to the third-party administrator and say, hey guys, you took the lion's share of all the profit in this. You really haven't done anything. Maybe you could help this patient be more successful with their hearing treatment.
I mean,
really just feels like a marketing scheme to some degree.
It's just, I mean, I lived it, I saw it, I did it. I understand the corners that have to be cut. For a lot of people that don't know, a lot of these managed care plans also come with these required follow-up periods from the provider as well. A couple of the managed care plans, that required follow-up period, including unlimited follow-up visits for a year-long period. I don't know what, think about your dentist, think about your primary care, think about all of these other professionals that you go to. Who signs up to do a year of unlimited care? You could have a patient in your office 15 times and 20 times, and you signed a contract that you now have to set aside an hour every other week to see the same patient who you ended up getting a reimbursement rate of maybe a couple of $100s for. I mean, it's insane. Insane.
Yeah, I mean, I guess fast food workers make more money when you really break it down over the course of that time.
Easily, when you look at a managed care, like a very standard managed care setup. Yes,
That's great. I think we like ripped a Band-Aid off here. That's like what is happening.
It hurts, okay? Okay, all right. So it was, that's why when you said earlier that Oticon, isn't going to offer the newest, the latest, and the greatest, I was like, love it. Anything to just be like, no.
Yeah.
Not for you.
That's right.
That's what I want.
So this actually rubbed one of these insurance companies the wrong way. So United Healthcare was pretty pissed by this, and they sent out an email.
Can I read the email?
You can read the email.
Perfect.
Absolutely. All right.
They were pissed, as they should be.
It's their own fault. It is their own fault.
All right. Dear network provider, United Healthcare Hearing is committed to providing the latest proven hearing aid technology solutions to our members. We take our responsibility seriously to make sure we fulfill the obligations we've made to our payers, members, network of providers, and partners. More than 80 million members have access to our program and count on us to deliver high-quality devices and services. I'm going to throw up. These programs are thoughtfully built and contracted annually through strong collaboration. Oh my, okay. Recently, Oticon released a communication regarding its future managed care product portfolio intention. That is the longest run-on I've ever heard. This does not align with our strategies and contractual expectations. As of today, United Healthcare Hearing has not committed to offering Bernafon. We are confident providers will find success in fitting one of the many brands and solutions in our existing product catalog. If there are any changes to products in our formularies in the future, we will communicate those changes directly and timely.
Okay.
You should read audiobooks.
I gotta step up my reading email game because holy cow! All right.
I was trying so hard not to laugh audibly so that we couldn't get it in.
You've been involved in that world more than what I was and more than Dr. Beck was. So I can tell that it affects you in a different way.
Strikes a nerve, and I only did it for a year. I feel so bad.
Can you imagine the providers do it for years?
For years and years and years and years.
And reimbursement goes down as inflation goes up, and you're expected to provide more care over that window. Ooh, man.
Yeah.
So quite obviously, United Healthcare Hearing was not happy with this, and they're basically like, we're not going to dispense your Bernafon products. You know what? We're just not going to work with you guys at all. Yep. We're not agreeing to any of this. And so it's like, we could probably find something else to fit these patients with because, it's the quality of care that matters anyway. And I'm like, you said throw up? Yeah. Was that the quote that you said?
Yeah. I want to throw up because that is just absolutely ridiculous. You're going to put this statement out and say, we are so committed to the quality and this and that and the other. You just had the company who said, you're not going to have our top product anymore. Its parent company, Demont, saying, you know what, we will offer you this entire lineup and, we've upgraded it. It's easy to use. It's simple. It's flexible. And UHC went, no, you didn't let us have your new ones, so... No, none about that. And I'm like, I thought we were committed to quality, guys. Yeah. I thought you just said we are committed to a high quality experience.
Meanwhile,
and you're going to look that technology line in the face and say no?
Meanwhile, too, like Oticon, the likelihood of them pulling this is due to lack of quality of care through these managed care pieces. Like, I'm sorry you didn't like being called out for doing things poorly, so you're going to dig your heels in like a petulant child.
It's almost like you made your own bed.
Yeah. It's like that. It's like that TikTok sound. Look, here comes a consequence.
Here comes the consequences of your actions.
That's hilarious. When I was participating in these managed care companies, I never had any of them reach out and be like, hey, listen, Dr. Olson, we want to make sure that you're doing a really high level of care. Are you doing regular measurement? Are you doing test box measures? Are you doing validated outcome measures? Like, they do not give a crap about quality of care.
Well, fit the hearing aid and move on to the next.
Well, and
that's the name of the game.
Well, because we've talked too about like the infrastructure, right, of a lot of, places like Costco or other places that are really just designed to sell the hearing aid. That's what they're designed to do. They're designed to sell you the hearing aid and really never think about you again, right?
Commoditization. Here's the product, not the care, the product.
And I don't know a single audiologist who got into this game to sell hearing aids.
To peddle products? No way.
No. We got in this game to treat the hearing loss.
Well, none of us even freaking knew what a brand of hearing aid was or how this system even worked.
I did not even learn the brands of hearing aids until, I don't even know, until my grad program, like in my amplification classes. Like, I did not get into this to be like, you know what? I can't wait to start working with Oticon.
Yeah.
Like, I didn't know. I didn't know any of these things.
I didn't know, and I wouldn't have been able to tell you which one did what better, because, that's the other piece about all this is like, well, we're going to take this entire product line away from you, but as a provider, I also know that there are some things that I'm sure that the Bernafon now also, but Oticon hearing aids can do. that other hearing aids don't do.
They can't do.
They don't do it as well, right? But I guess too, like you said earlier when we were kind of planning for the episode, is like, well, if you're not going to do real ear measurement anyway, you're not going to do everything the right way anyway, all of them are really great because they're all going to kind of stink in all the same ways, right?
That's so
all of them
true.
are perfect options when they all suck.
Right.
Yeah.
If you're not going to do it right, then you really don't need that product line. You really don't need it all.
Pulled out of the box and set to first fit, it really doesn't matter.
Yep.
Truthfully.
Totally agree. But I think United Healthcare Hearing here, they understand the magnitude of what's just happened here.
Yeah, they know.
So they know that if they start losing all of the name brand devices that consumers are aware of and they've been educated on and they see me talking about on the channel, and it's like you can't get any of them because what will potentially happen here? You know, if Oticon pulls this off and they stick to their guns, which we have reason to believe that they will based on this next email I'm going to share, but they know that if they lose all of these brands, that they're not going to have as strong of an offering to encourage people to want to use their insurance, right? Because consumers are not stupid. You know, their members are not stupid.
If they say yes to Bernafon, this means now when Phonak says, you know what, instead we're going to put out Sennheiser something, or you know,
only
any one
Unitron,
of these companies, I'm only going to put out. But you know what, UHC did something kind of similar. They put out their Unitron Relate product, which is a UHC only one. So it's not rare for a lot of these third-party companies to come out with their own private label offering. Like True Hearing devices are, you know, Signia devices with a white label on there.
I'm sure it's because they wanted better devices in their thing. No, they just wanted to freaking
because they
cut costs
made it nice.
in any way possible. And I don't know if you guys, like, my insurance premiums have been going up, yet like my deductibles, like, and all that have been going up.
My premiums
and my coverage is getting worse.
My coverage is worse. My benefits are worse. And then suddenly now I have to get a lot of my care administered through other third-party types of things.
Right.
And all of these things are such, you know, a privilege to be able to do, right?
Sure.
Because there's a huge population in the U.S. that cannot go that route. And then you are just out of luck.
We haven't even talked about the fact that you have to go to an in-network provider with one of these third parties.
To use your benefit
to
at
use
all.
your even use your
Otherwise,
benefit at
you
all.
have nothing.
Because like you can't even come to our clinic and use your third party where you could have come to our clinic if you had traditional insurance coverage for an out-of-network provider. Then you can go to whoever the heck you want to. But if you're in these if you have third-party coverage, you can only go to these certain providers. And I'm sure that those providers are of the utmost quality, and even if they are, like, you have no clue who they are, and you have to go to them if you want to use your benefit.
And again, too, and I want to take this opportunity as well to say, like, the providers who work with managed care are still good providers. They're kind of being held hostage by this system just as much as a patient is as well. And I think that, again, goes to why Oticon, you know, is also taking this step, at least in the emails that we received on the provider side, saying, you know what, we value you guys more than they do. Let us do this separately. It's kind of funny,
right? It's kind of like they're like, listen, guys, we know you're getting screwed over as providers. We're going to try to help you out. Like, here's a product you can fit quickly with people. You still have an offering for them, so hopefully they can be happy and not have to come back a million times because we know that you lose money every single time they come back.
Well, and a lot of those providers that are doing managed care are also independent providers too, and so this is a way to say, for your managed care people, here's a product for you, but also that same provider could then turn around and see someone who doesn't have a managed care plan and say, oh, I have the Oticon Intent hearing aids. I fit them, patients love them, we're having great experiences. They're just not available through your managed care plan, but I can still fit that hearing aid to you if you see me independently, you know? So it's going to be, again, it's just that kind of that three-system relationship between patient, provider, and that third party. Providers already knew that we were getting stiffed, and we knew that the manufacturers were too, but they weren't doing anything about it. They were still offering this entire lineup. This is a huge way to be like, this is the first time we have seen one of these companies straight up go, no. No. And I think that's a big move.
That's a big move.
Huge move, and they want others to join.
And they want others to join, and we know that because we have an email about that. And I think that they understand the magnitude of what's happening here is that if they don't figure out a way to prevent the erosion of what they're doing as manufacturers, then they're going to be in trouble. So let me actually read this Follow-up email from Gary Rosenblum, who's the president of Oticon here in the US. So, dear valued provider and partner, our Oticon strategy has always focused on launching best-in-class technology, high-quality innovation, and you, the hearing care professional. We believe in what you do, and we want all hearing care professionals to have ample time to provide the best patient care possible, including robust counseling services, freedom of choice, and long-term follow-up services. Recently, Oticon decided not to offer our newest Oticon Intent technology to United Healthcare Hearing because we do not believe United adequately values your professional services and the life-changing outcomes you provide when utilizing our newest innovations. As we look toward the future, we are concerned that the decline in managed care product reimbursement and hearing care professional and HCP, hearing care professional fees will ultimately result in diminished patient satisfaction. Our proposal to United would maintain our broad line of cutting-edge Oticon solutions, including Oticon Real, while also offering our new Bernafon brand, a robust new platform with exceptional value and state-of-the-art technology across all price points. United disagreed with our thoughtful strategy and has removed all Oticon products from most of their formularies. We are strategically committed and remain intensely focused on developing world-class leading solutions and supporting our hearing care professional partners. Accordingly, Oticon stands by the decision to exclude our newest innovation, Oticon Intent, from United Healthcare Hearing formularies. We want you to have the best opportunity to differentiate yourself in your community with groundbreaking technology in combination with your professional care. If you share our strategic view on innovation and the best hearing care professional care, we ask for your consideration in two areas. Number one, consider recommending Oticon and our newest Oticon Intent technology as your premium brand of choice, as it is not available to any United managed care patients. And number two, consider asking all other hearing aid manufacturers to reconsider their strategy of launching their newest products into managed care while simultaneously launching them to hearing care professionals in the private, non-managed care market. Oticon's strategic focus on innovation and best-in-class hearing care professional care, along with our past decision not to launch an OTC device, differentiates Oticon as the only manufacturer solidly standing firm for the independent practice. Oticon wants all of its partners in hearing healthcare to not only survive, but to thrive in a challenging market where we see too many independent practices struggling with managed care and working too hard to maintain financial stability in their practices. Thank you in advance for your consideration. Please feel free to contact me, Gary, if you have any questions or want to provide feedback. What about that?
If I wasn't mic'd up, I would run several laps around this coffee table.
I was
like
thinking
this.
like good slow clap. Yeah.
Slow clap, kind of like that.
It's
so much to unpack.
There's a lot to unpack, and I think it really goes to, because, obviously this email came after all of the first 3 emails, right? This is the last in the series of 4, I think.
Yep.
But the initial intent, again, no pun intended, of the change to their strategy was very hopeful to, clinicians, and then to have them, really hold their ground, knowing that a very large part of the market is now very unhappy with them and saying, you know what, you're not going to strong arm us out of this decision because patient outcomes are deteriorating by going through this modality of providing care, right? You're providing hearing aids, you're not providing care. And the hearing aid companies know, we're all out here too on the internet, right? Informing people that, their care might not be up to par. And they're saying, we've kind of had it with that. No, thank you. You as a provider are incredibly important. The way you do your job directly impacts how we can do our job. Yeah. We want you to do a good job.
Yeah.
What a concept.
Yeah.
Right?
Yeah. And you called it. I mean, you're like, I think that they're starting to notice that patient outcomes are starting to suck, right? When you go through these managed care companies, right?
And this is I think that, we talk about it from the hearing aid or the, hearing healthcare space lens, but the idea of managed care overall and Medicare Advantage plans having, a highly predatory basis to them is impacting all sorts of providers, everywhere.
Yeah, it's not just hearing care.
Dentists, primary care providers. I mean, all of these providers are experiencing this. And what is happening is we're watching as these independent practices are taking on these managed care or third-party companies. They're working with them. They're losing revenue. They're losing profits. And they get so weak to the point where they need to sell or close their doors. And then they watch as, these Medicare Advantage, some of these companies will literally come in and buy them up under their third-party names, not necessarily for hearing healthcare yet, but I'm sure it can get to that space. It's happening all across the board. And so for a company to really truthfully take that and stand up and say, no, we're not going to watch our quality of care suffer. We're not going to watch all these other independent practices get absorbed, have to merge, and then we end up in this space where now everyone's going through managed care. All of these devices are priced so low. I mean, it helps no one. It helps nobody.
Just to be clear here, if our clinic that we all work in together accepted managed care, there would be exactly one audiologist that works with us. It would be me, and I would only be able to see X amount of patients per day, and I would have to be cranking through them. Like, it literally would not work. And certain private practices believe that they have to participate because they're forced to.
No,
and they don't realize that you can actually serve your community better if you do not participate in these things. And the manufacturers have been actually directly competing against us, and we're using their devices to treat hearing loss. And so Oticon is really the first one to come out and be like, you know what? We're not going to compete directly with you anymore. We're going to support you because we understand the value that high quality hearing care makes, not hearing aids. High quality hearing care makes with the use of a high quality piece of technology. And Gary's a very influential president inside of the United States with these different hearing aid companies, these hearing aid manufacturers. If he gets enough support behind this, you're going to start seeing that you cannot use managed care and get high level technology. You cannot use managed care and get a high level treatment experience when you go into a hearing care professional's office, because they're essentially, the insurance companies, the way I see it is they flew too close to the sun. They had a great thing going, and then they just kept reducing reimbursement,
they literally
increasing
just kept
premiums.
It.
They slash premiums, increase prices, slash premiums, increase prices, and it eventually gets to the point where, like, listen, we're not going to freaking take it anymore.
I feel like that's definitely a song.
You know what's so interesting too is I met Gary maybe it was right when I started working at Applied Hearing Solutions, so maybe like a month or two in, and so that would have been in 2022, yes. And this, he had been giving a presentation kind of talking about like trends and outcomes and coming out of COVID and what that did to hearing aids and all of these things. And people literally mentioned in that talk about managed care and what's your plan with this for managed care or this, and we're getting crushed, and and I remember in the presentation kind of being like, well, it's not really Gary's fault. I don't really know why managed care is getting thrown into this conversation right now. And he had alluded to this idea of like, we know it's a problem. We have we have plans in place, like all these, very high level, can't say anything, stuff that you have to dance around it. But I knew, I trusted him in the moment. I was like, you could tell something's up his sleeve, but I don't know what that something is. And it probably did take 2 years to get to this point of being like, this is our long game strategy of, timing has to be right, a new product release has to be right. They did this very publicly. It's obvious that when UHC put that alert out of this wasn't in the contract, this did not take place behind closed doors. This took place publicly on purpose, so that it was like we're dropping this to you the same day we're dropping it to them, like we're gonna get them, and like it was a sneak attack in a way. And so now it's playing out in front of our faces, but we can see who's on which team here,
right? And who has the moral high ground on this, right? You could argue that United Healthcare has the moral high ground. You could argue that Oticon has the moral high ground. I know how I feel. We'll let you guys decide that for yourselves, right?
I mean, UHC in their release could have said, it really concerns us that we feel as though a manufacturer that we've partnered with for years feels as though the quality of care has deteriorated to a point that they chose to pull their most premium offering from our product portfolio. And for that reason, here are the steps that we have committed to taking to ensure that patient outcomes don't suffer by blah, 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 blah. That's what they could have done.
Yep.
Instead, they said, we still have a ton of products, so it's fine. It's fine that Oticon pulled that. We're not interested in Bernafon. And talk to you soon.
Yeah.
That was it. I'm like, you didn't talk about the fact of why they pulled the product. Let's go there.
Well, and that's exactly the point too, because and when we started out the episode, right, I did bring up those concerns about how are we going to, offer same things? Like, is it fair? Is it not? And UHC could have had a really good response. They could have taken the opportunity, because really, this could have been a softball. Right? Yes, Oticon was, drawing a line in the sand, but it also just could have been a softball, like, hey, these are our concerns, here's what we want to do about it.
And UHC could have
please rise to the challenge.
Thank you for telling us that. We will get better.
And then suddenly, when you kind of throw a fit like that, that is when you lose all standing, right? Because if you're going to sit there and throw a fit, you've lost the argument.
Also, when he said that they've pulled all Oticon stuff.
That's right.
Yeah.
It is a child that is throwing a hissy fit, is what that is.
Because, though, I'm sorry, Oticon's a huge brand, and they do have fantastic products. So for UHC to now go, okay, skirt, we're not even going to let you have your other product offerings here. Silly.
If I was of Medicare age and I chose not to go with traditional Medicare and go with a Medicare Advantage plan, that because they had United Healthcare hearing third-party coverage in it, and I wanted to get Oticon hearing aids, I would be pissed right now.
Pissed. Oh yeah, you know what? And I love this. I'm like, heck yeah, don't have Oticon at all. I would love to be the only one that'll get you set up with Oticon. I would love if you could not get an Oticon product through your managed care. So this works great.
Or Bernafon,
for me.
probably. Like, they're probably not going to offer anything of this stuff.
It sounds like they said
no product. They're basically saying sorry.
But you know what? It's the same way that you said no to managed care. You said, I'm not going to participate. Oticon said, I'm not going to participate all the way. That made UHC say to them, well, you're not going to participate at all. You're looking at two sides of this third-party managed care equation going, no thank you.
Yeah.
And both are going to remain successful.
And both are going to remain successful.
And hopefully
You're held back by managed care. Oticon's going to be held back by managed care. Everyone is much better. Your time is much better spent elsewhere. Take that time rather than seeing managed care patients. Say no, refuse to participate in that system. Use that time to market your practice better, have a higher quality of care, be known in your community for being one of those really reliable, dependable providers, and watch how that grows your practice, not how managed care grows your practice.
And it demands a better system,
it
right?
does.
Because all of this really speaks to a lot of the ways that a lot of these systems are just very predatory, and they're not actually doing things but the right way for their people, right? For their their users, right?
Members,
Their members. Thank you. So it speaks to this larger thing of well, if we don't start demanding as a profession, as in conjunction again with these manufacturers, we don't start demanding a better system for our patients, who's going to?
Yeah.
So.
Well, exciting news is that I've extended the offer for Gary to actually come out here on the show.
He should.
I fully expect him to accept that and come out here. So, Gary, if you're watching, I've already thrown it out there.
Gary.
So, right?
I hope you can tell we're all big fans.
All right, guys, if you enjoyed today's episode, make sure you hit that like button. If you are not yet subscribed to the channel, go ahead and hit that subscribe button with notification bell. And as always, we will see you next time.